Osteoarthritis of the hip is multifactorial. A lot of things go into play. How did you use it throughout your life? Did you play sports? What kind of job did you have? Your body habitus. Genetics comes into play. Did you have previous surgery like an ACL surgery or hip surgery as a child? So a lot of factors go into play, and this can contribute to wearing out of the cartilage that protects the joint surface. And once this happens, you get a condition known as osteoarthritis, where the bony ends are rubbing against each other, causing friction, pain, stiffness. Hip osteoarthritis classically presents with pain primarily, stiffness. All of a sudden you may notice you're not able to tie your shoe, so the hip and the leg doesn't come into the correct position. And you may notice a limp that others may tell you, hey, you're limping. And that is classically a sign of hip osteoarthritis. And the pain tends to be localized around the groin, the upper thigh, and the buttock region. Now, knee osteoarthritis generally follows the same principle. Pain, stiffness. You may notice the joint is swelling. It may not bend back as much as you'd like. It may make noises. And also you may get a deformity where it bows, or it may have a knock-knee deformity. And these things become apparent and really impede your quality of life. Osteoarthritis flare-ups tend to occur when, as part of life, you tend to use your joints a lot more. Let's say you like to play pickleball, or you tend to like to hike a lot more. All of a sudden the joint is seeing a lot more stress, and unlike before when it had good cartilage cover, now all of that stress is being transferred to that bone grinding on bone, and that causes what we call a flare-up. Classically, an increase in the amount of pain, increase in the amount of joint fluid causing that swelling appearance, and certainly warmth and other symptoms associated. Treatment of osteoarthritis, just like its causative factors, it's multifactorial. Conservative treatment is a huge part of treating osteoarthritis. So when you come into my office, for example, we treat this conservatively with perhaps an injection, and the injectables include corticosteroid, or what we call cortisone. Hyaluronic acid injections may help. There are experimental injections like platelet-rich plasma. And then there are wearable braces. Now we make custom unloader braces that may take the pressure off. There are assistive devices like a cane. Physical therapy is tantamount to recovering from our osteoarthritis. It helps strengthen your muscles, it helps you walk better and function much better. Certainly once you don't respond to these conservative measures, then we talk about surgical intervention, and that's where joint replacement comes into play, and that can restore function and reduce pain. Prevention of osteoarthritis is always a question I get. It's a tricky one. True prevention is probably not likely, but there are certain things you can do, especially in the formative years. Once you become an adult in middle life, one, keep your muscles strong. A good low-impact aerobic activity is huge. Again, like I mentioned, low-impact activities. You want to keep your body habitus in check. Avoid high-impact activities. Be careful with associated surgeries like ACL. You want to make sure you rehab well. And certainly be careful with high traumas and other impactful activities that may contribute to the progression of osteoarthritic change.